Did you know that an average person falls asleep in just about 7 minutes? I'm hoping by the time I'm done with my 7-minute speech, nobody would have fallen asleep. According to the National Foundation for Cancer Research, there's a person dies from blood cancer every 9 minutes. Put it in other words, imagine you're trying to fall asleep, and by the time you actually fell asleep, there's one other fellow American who would have fallen asleep eternally due to blood cancer. Fellow Toastmaster and guests, blood cancer, termed leukemia by scientists, was the first described in 1847. For over 150 years, humanity had been battling with the blood cancer, leukemia, and there's been a lot of ups and downs, mostly downs. However, today, I'm going to educate and inspire you with hope in this battle against leukemia through a patient's story. Who was diagnosed with acute promyelocytic leukemia, or APL, which is a subtype of a more commonly known blood cancer called acute myeloid leukemia, AML. I want you to learn something about APL, so I have a few objectives in this presentation. Don't worry, they're not science rocket. First of all, we will define what acute promyelocytic leukemia is, and then we'll go over some of the basic facts of APL, such as disease characteristics, symptoms, and treatment. Last but not least, I want you to connect to the disease to a level of the patient's story, to the patient's perspective, so you can put a face to the disease. Oftentimes, it can feel dull to talk about science, biology, so I want to start out by introducing our patient's story. Her name is Katie Collier. She was 18 years old, tall girl, 6'3". She was a star in her basketball high school team. During her visit at the University of Washington back in 2001, she was sent to the ER, and right there she was diagnosed with acute myeloid leukemia, which eventually got changed to acute promyelocytic leukemia after more extensive testing. Again, APL is a subtype of AML and represents about 10% of all AML cases. Now, let's learn a little bit more about APL. APL was first described in 1957 by a Swedish author named Hillestad, and he concluded that APL seems to be the most malignant form, meaning the most aggressive form, of acute leukemia. APL is a cancer of bone marrow cells uniquely characterized by the abnormal growth of promyelocyte. What is promyelocyte? So promyelocytes kind of mature cells in white blood cell into white blood cells, which help fight infection, bacteria, and virus. Here is a picture of a pathologist looking at the microscope, searching for abnormal cells. Some symptoms that patients with APL may experience include bruises everywhere, feeling weak, sharp joint pain, tightness on chest, fever, infection, and hemorrhage and bleeding. Our patient Katie had symptoms of gums bleeding, which was the reason that prompted her to go to the ER. This is important because excessive bleeding is the main reason why many patients die so quickly. Generally within a matter of a few weeks, if they do not get their treatment right away. Therefore, APL was considered a medical emergency. And in our lab at Mayo Clinic, we would try to get diagnostic results out to the doctors within 1 to 2 days. Receiving treatment early is critical for the survival of the patient. The most surprising thing about APL is you treat them with all-trans-retinoic acid, or ATRA. In other words, it's vitamin A. It has no harm to the body at all. So when doctors suspect that the patient has APL, they'll get it on the treatment immediately without even waiting for confirmatory testing of the results. Another drug that I treat with is arsenic trioxide, or ATO. And usually they're used in combination. It's quite interesting that the treatment for APO turned out to be just a vitamin and arsenic, which is poisonous. However, Dr. William Withering argued that poison in small doses are the best medicines, and the best medicine in too large doses are poisonous. So our patient Katie was treated with a combination of ATRA and ATO. Both do not harm normal cells. So Katie was happy to keep her long hair during her treatment. Beautiful long hair. So now how does it turn out for Katie? She emerged out of the treatment tunnel, shared her story and hope that other patients will find strength. And she also plans to give feedback by volunteering while she attends college at the Ronald McDonald House at Seattle, resident for ill children and their families. Her treatment was effective, and she gratefully said, being out on the court gives me a sense of normalcy. She's happily living a normal life now. So to sum up, there are about 30,000 cases of AML diagnosed each year in America, and approximately 1,000 of those cases are APL. With the combinational therapy of ATRA and ATO, APL's cure rate exceeds 90%. That's very astonishing. The victorious battle against APL is a rare story in the world of cancer. And we as humanity have successfully revitalized lives like Katie to enable her to live on and pursue her own dreams. Everyone around the world is cooperating to fight the battle against cancer. Even within our club, in the past, we actually donate money to an activity called Relay for Life to help other people fight cancer. What I want to say is there's hope that we can fight cancer. And with everybody working together, one day we can turn this rare story into a common story for all other forms of cancers. So with that, I would just want to share with you some of our reference. And if you have any more information, feel free to let me know and I'll share those with you. Thank you.